Access to health care and the intersection of health and race have been important topics in the news, particularly these past few years. History professor Manuella Meyer examines the social and political history of medicine and mental illness in Latin America. Her research includes areas related to public health, the history of welfare, gender and race, and topics that our nation and world are grappling with. Manuella, I'm looking forward to learning more about these important issues with you.
It is an honor and a pleasure to be here with you today to have this conversation.
Can you start by providing an overview of your research and what you're currently working on?
I am a historian of Latin America, and specifically, I look at the sociocultural and political history of the region, and my particular interests look at the embeddedness, if you will, between politics and medicine, as well as the provision of public health, and specifically the provision of public health psychiatry. And I look at how public health officials try to provide interventionist methods as it relates to trying to secure good mental health for populations and communities.
So part of your scholarship focuses on mental health in children. And I wonder what you would like us to know about that.
I think that what I would like us to know about mental health and children is that childhood has a history. We often think that childhood actually is this very fixed period in time, and it is the same everywhere. How we see that there becomes this specific focus at the turn of the 20th century in which the child, and childhood in particular, becomes an emphasis of concern for nation states all around the globe. So I want us to think about how the legacies of the early 20th century and this hyper focus on children and childhood also continue on to today.
You received a Fulbright in 2018. Can you tell us a little bit about that Fulbright and the experience you had while doing that work?
When I received the Fulbright, I actually went to Rio de Janeiro and I visited a variety of libraries and archival sites there working on the book project, Making Brazilian Children. And in particular, I ended up spending a lot of time looking at this idea that many mental health professionals there developed. And that was this idea that they wanted to create a city of minors in 1938 in Rio de Janeiro. So I spent most of the time there really studying this fascinating idea that actually never came to fruition. But I am intrigued by these ideas that actually never happen, but they reveal the aspirations and the utopian goals of these reformers.
You've taught at Richmond since 2009. I wonder if you could tell me a little bit about the changes you've seen in your students and their changes in their interests.
One, I've seen that the student body become more diverse. And here we're not just talking about racial, ethnic diversity, but we're also talking about first-generation students. We're talking about sexual orientation, gender, so that I actually think that diversity in this sense is a very positive attribute, and I really commend not only our students, but also the faculty and the administrators that take diversity seriously and not simply as window dressing. And then I think that the second biggest change that I've seen in our student body is this culture of research. So that research is not just limited to the sciences, but that we have students in the humanities, in the arts, and the social sciences doing this deep, intensive dive and taking real advantage of this concentration of expertise that we have on campus so that they can figure out the critical questions and discoveries for themselves.
Well, thank you, Manuella. I'm delighted you're here. You were one of the first people I spoke with after accepting the job and before I moved to Richmond. And I was inspired by the discussion we had about mental health in Rio in your book. I think you're a model faculty member who is a teacher, scholar, who cares about research and the relationship with students.
Thank you.